Hi, I'm Ben with TechCrunch TV, and today we're here with Leslie Ziegler and Halle Tecco from Rock Health, and they're going to tell us a little bit about what Rock Health is. So what is Rock Health?
Rock Health is a digital seed accelerator for healthcare startups.
Great. And so can you talk a little bit about what the opportunity is that you guys see in healthcare startups and what made you guys choose this?
Yeah, healthcare is the largest industry in our economy, and there's relatively little innovation in terms of software compared to other sectors. And we saw that there was a huge opportunity, and I think a lot of people did recognize that there was a large opportunity for software startups to disrupt the space, but that there were still a lot of barriers. So we still see a lot of regulation and uncertainty around HIPAA compliance and FDA regulation, and so there were challenges for entrepreneurs that they would look at this industry and think that there was lower hanging fruit elsewhere. So we think that makes it an even bigger opportunity because fewer people are chasing this industry.
Great. And there's a really fascinating story, Halle, of how you started this. Can you talk a little bit about that?
Sure. So when I was in graduate school, I was working at Apple, and I was in the App Store covering the medical and healthcare segment. And I sat next to the woman who covered gaming, and we became friends. And I was very jealous of her job because she was meeting with tons of really interesting and creative developers every day. And they were coming in, and they made these apps that they absolutely loved. And what we say at Apple is like, love is in the details. And they came in, and her whole cubicle was really colorful, and there was just such a vibrant energy around the gaming category. And then I was in the healthcare and medical segment, and relatively there were fewer apps, but they were also just less creative and robust. They were less exciting. They weren't taking advantage of the native features. This was in 2010, so even just since then, there's been a huge improvement. But we noticed that the types of entrepreneurs that were getting into healthcare just weren't the same people. Actually, most of the developers in the healthcare space were coming from large organizations and not necessarily these like scrappy, creative entrepreneurs here in Silicon Valley.
And Leslie, could you talk a little bit about what the challenges are that health startups face and how that's different from just your general tech startup?
Sure. I mean, it's difficult to build a good product, but in healthcare, there are so many regulations, there are rules, a lot of dealing with the government, and there are a lot of barriers to entry, institutional sales. It's any highly regulated industry is going to have these problems. So, and I think it's one of those things, you look at it, if you don't have a lot of information, you think, wow, these challenges are pretty insurmountable. There's just, it's difficult to find good information on it because it is a relatively new space. And, and no one's really talking about it yet. And that's really a big part of what we're trying to do is, not only educate the entrepreneurs in our program, through workshops and bringing in really amazing people, but also, open sourcing what we have to share with the community at large in the hopes that, more entrepreneurs from, who are building games or social applications start, revisiting building something in health.
Great. And you have a lot of really exciting partnerships. Can you talk a little bit about those and how they specifically help with dealing with some of the challenges that the startups face?
Yeah, absolutely. I mean, so one of the things that's really important and I think special about Rock Health is that we try to bring all of the right people to the table. So, everyone from, VCs who are absolutely essential for capital to, big companies like Procter & Gamble, payers, we've got United Health Group, Pharma, Genentech. So we really are bringing together lots of people that normally don't talk and don't work together to solve these problems. And we're providing all of those resources. They're very involved with the program. They come in and spend time with the startups, advise them, help them out. Actually, 3 of our companies have pilots at the Mayo Clinic. So it's very exciting to be able to, kind of get in there and iterate and work with the people who are, making decisions.
Great. So there's, especially in the Bay Area, plenty of incubators out there. So what would you say to a startup that happens to be in the health field, but is also looking at more well-established incubators like Y Combinator, Techstars, one of those? What's your pitch to them in saying, come to us instead?
That's a good question. Well, there are a lot of really fantastic incubators, and so I'd encourage the entrepreneurs to figure out which one's the best fit for them. I think if you are someone that's going to be building a product that has to go through the challenges of thinking about institutional sales, about piloting with hospitals, about going through FDA regulation, I think that it makes sense to go to a place that actually has the resources to help you overcome those challenges. But ultimately, you have to like the people behind it. You have to be excited about the other teams. And we've already gone through one class, so we're slowly, becoming a little bit more widely known. We had 13 teams that demoed in November, and a good handful of them have already received funding. So we're hoping that those startups can now be an example of how an incubator like Rock Health can help them achieve their goals.
Great. And so how do you guys define a health startup? It seems like it can be as broad or as narrow as you want. Do you stick to specifically healthcare and in hospital? I know you have a few others that are outside that. Is there a focus, or how do you guys look at that?
Yeah, so we love the span of healthcare. We like actually our portfolio to be pretty diverse. So anything from fitness, we have Skimble, which has now had over 2 million downloads. They're one of the leading iPhone apps, actually iPad too, and Android apps in the fitness category, all the way to teams like Omada Health that is going to be announcing their funding soon, but they're in the diabetes prevention space. So we like to be able to bring in a diverse set of entrepreneurs working on different problems within healthcare. I think there's a trade-off between consumer apps that don't have to go through the ecosystem of the hospital and going straight to the patient versus something that would be more of an enterprise product. So there's definitely trade-offs in terms of the needs of those startups. I think there are probably more consumer startups out there, but enterprise ones are actually more likely to get funding. So we like to kind of have a balance, and our partners also like that too.
What do you guys see as the biggest opportunity in the whole space?
I'll take that one.
I don't know. I mean,
as a patient.
Yeah. I mean, actually, so, as a patient and as a designer, I think that historically we've seen, if you've ever been to the hospital or the doctor's office, when you're handed 2 sheets of paper when you're, sent home, it's not a great experience. So for me personally, I think, focusing on patient experience, building things that are people-centric, and really putting people at the center. People are clearly not at the center of the medical system as it exists now. I can't tell you how many times I've gone into the doctor's office and just wondered, like, okay, why am I getting 50 phone calls about this? Why isn't there an email or a text message? And even systematically, like with we saw that really cool lab design report that Thomas Getz redesigned. But even things as small as like the piece of paper that you're handed when you go home, really just needs to be rethought.
Have you noticed in working with specifically hospitals and maybe some of the bigger healthcare companies, how much of the problems do you feel are technical problems that need to be solved, where you bring in design and maybe startups just to come up with better solutions? And how much of the problems are more bureaucratic and political?
Wow, well, that's a good one. For me, it's kind of equal. I mean, I think they both have to be fixed. There are structural problems that prevent solutions from being implemented widely, from even getting the right solutions in front of the right people, just because it's such a tough process and there are so many layers. And then, once you actually have a great idea, getting that implemented at scale is very difficult in these big systems. So really both have to come together and work.
And there's been some resistance among tech investors to invest in healthcare startups. Have you noticed any of that? And you have some great partners, so what have you noticed in dealing with them, and how did you convince them to come on board?
Actually, I think that tech investors are really excited about this space because actually Mark Andreessen wrote a really good piece about how software is eating the world, and healthcare and education were kind of the last 2 domains to be touched by this. And I think those types of conversations are sparking a lot of interest. That being said, there aren't a lot of great models for success and outcomes and exits. There's not the Facebook of healthcare that these investors are getting excited about. So we see more shopping and prying, and VCs that are coming. Our demo day was packed with VCs, and they're interested in the space, but there's certainly more people that are looking and shopping and learning than investing at this time. That being said, we work with Excel, NEA, MDV, which are some of the most well-known tech investors that are committed to the space, and they're actively making investments here. So I think there's hope.
Yep.
And my last question, out of the last batch of startups that came out and with the ones that you announced recently, Which ones are you the most excited about? Are there some that stand out? I know it might be hard to
You
choose.
can't ask us to pick favorite children. That's too hard. We are, I think that's one of the things that makes Rock Health really special is that we are a family. We have a culture of inclusion. We all help each other out. We solve problems together. So, I mean, yeah, it is really, it's like asking to choose your favorite child. We're excited about all the work that they're doing.
Yeah. I think there's some that are definitely have like a wow factor because they're definitely unusual uses of technology.
Can you give an example of
Yeah,
that?
so I'll give you 2 examples. So one is a team that just graduated from Rock Health called CellScope, and they've built a plugin for the smartphone that sits over the camera and actually turns your smartphone into an otoscope, which is what parents use or what doctors use to diagnose ear infections. So now you have a smartphone, any parent anywhere can diagnose the child's ear infection from home using just this like easy device that sits over their iPhone. So that's something that definitely, when we tell people about that one, it like is just a big leap from where we are today. And then there's another team that has been getting a lot of buzz lately called BitGym, which came out of, it sounds like bitchin', but came out of Rock Health as well. And they've built a really cool iPad app that, it's hard to explain, but it actually sits on your exercise equipment and uses the motion that it detects to go through a game that you're going through like outer space or Italy or wherever it is.
Exercise fun.
And it's making exercise fun using that as well as face recognition, so it can see you move. So you can like move to the left and move your little cart. So it's just making it more of like a video game while you're on your exercise machine. They've been getting a lot of buzz because it's just a really unique use of technology.
All right, well, thank you so much for joining us today.
Thanks for having us.